Today we're going to be looking at Eastern equine encephalitis. Disclaimer, this video is strictly for entertainment and educational purposes. What is Eastern equine encephalitis? Eastern equine encephalitis, also known as EEE, can also be referred to as sleeping sickness. Encephalitis is inflammation of the brain. This particular strand of encephalitis is known to be particularly fatal. In the United States, 6 to 8 cases are reported every year. It affects those living near the Atlantic and Gulf coasts of the United States. It is a disease that is threatening enough to be considered a bioweapon. Transmission. Animals found in the Atlantic and Gulf Coast regions can carry the virus. Mosquitoes are known to be the main culprit of spreading this disease to humans. It also affects the horse population. It is also possible for this disease to be spread through the air. Those that are infected do not need to be quarantined, and it takes 3 to 10 days for the virus to incubate before symptoms begin to show. Signs and symptoms. There's 3 main parts to this illness. There's febrile systemic illness, hemorrhagic fever, and encephalitis. Febrile includes fever, aches, and pains. Hemorrhagic includes bleeding, usually internal, along with a really high fever, and encephalitis, which is inflammation of the brain and spinal cord. Victims are typically asymptomatic until viral incubation is complete. It has a 41% mortality rate even if it's caught early. Late diagnosis tends to lead to multi-organ failure and ultimately death if major symptoms set in before treatment begins. So treatment. There's no official drug to treat EEE in humans, but when it comes to animals, particularly horses, there are drugs that are able to help it. So ensuring the treatment and monitoring the symptoms is crucial. Ventilator support is often needed. Brain scans can monitor swelling and needs immediate attention. In most cases, long-term effects are common and can be debilitating, and these persist after the person has been cured of the disease if they've been infected. So prognosis. So roughly 50% of survivors will develop some kind of neurological disability. It is common for victims to experience a decline in motor, cognitive, and sensory function. Seizures are a common long-term effect of the illness, but it can also bring paralysis, intellectual disability, and psychosis. Pretty nasty stuff. Thank you for watching.